Water is an important resource that no one should take for granted. On the Siksika First Nation in southern Alberta, two distinct but equally vital monitoring systems work to protect public health. Water monitoring looks at our drinking water sources, ensuring they remain safe for consumption and free from harmful contaminants before reaching our taps. Wastewater monitoring, on the other hand, analyzes what we flush away, providing important early warnings about the community health risks and environmental impacts after we've used this precious resource. Together, these monitoring systems form a complete picture of water's journey through our community. This is the story of how we track, protect, and learn from every drop.
Okay, my name is Christian Rabbit Carrier, and I am from Siksika Nation, and I am currently working with Siksika Nation Public Works, and my profession is a water and wastewater operator for the nation. What we do is we take care of the residential and non-residential wastewater. So that comes from your, from your toilets, bath, dishes, or your laundry. It all goes in from your system into our sewer system, where when it gets to our lagoons, it goes through a treatment process. And when it's done being treated, we necessarily grab a sample from the last cell in the lagoon where we discharge it. But before we can discharge the wastewater, we got to make sure it's safe for the environment. So we necessarily get a sample and we ship it off to WSH laboratories, what usually takes about a week to a week and a half till we get our results back, making sure that it is safe for the environment. And then we'll be able to open up a valve and release it.
Wastewater monitoring is tricky because it requires a certain level of wastewater treatment in place. And for most First Nations across Canada, that infrastructure doesn't exist. It's never been funded well. It's a huge gap that exists across Canada. In Siksika, we have a really strong wastewater distribution system. But by the same token, because of those same ongoing issues with funding, we have some older lift stations, and the pipe networks don't necessarily collect all First Nations across the entire community. So we see that in most First Nations. You'll have a certain percentage of the population that's on a pipe system. Everybody else is on an individual system. So this project really is for those that are on a centralized pipe system. So that's one of the first challenges, is that you're not going to get the entire community. But that's okay. If you're getting 40–50% of the community, it's going to give you a good sense of what's happening.
Yeah, I think it's really been, it's a new kind of emerging thing. We've really seen it over COVID, where we had, the city of Calgary constantly monitoring the water for COVID. And so we too get that data specific to Siksika. We're very fortunate to know when there's peaks in COVID over the past couple of years, or influenza. And now we're just working in getting a database for opioids. So, it might give us some clues as to what kind of substances are here and on the nation, right, that we should be prepared for, that we should be creating an awareness for. And again, it all falls under the public health and community health realm of keeping people well, and always being ahead of anticipating what areas we maybe need to add resources to and supports to, and what we might be seeing in our clinic, or what people might be exposed to. Again, it's all about prevention and health promotion. So that data, I think, in the future is going to allow us to, again, develop future programming and making sure that we have enough resources to support the community. And again, it's in its infancy stages here in Siksika Health, but we are working with, again, our partners from U of C to understand the data and be able to interpret it so that we can use it, for the health of the community.